Most people think alcohol withdrawal is just shaking and sweating, but one wrong decision here can literally cost a life. Today, I'm breaking down CIWA scoring in a way you'll never forget, whether you're a nurse, student, or healthcare professional. Stick with me for the next 5 minutes, because this is one of those tools that separates guessing from safe clinical care. CIWA stands for Clinical Institute Withdrawal Assessment for Alcohol Revised. It's a standardized scoring system used to measure how severe a patient's alcohol withdrawal really is. It helps answer one critical question. How sick is this patient right now, and do they need medication? CIWA is not about judgment, it's about patient safety, preventing seizures and avoiding over-sedation. Quick poll, are you a nurse or healthcare professional? Type HN in the comments. CIWA's scoring is based on 10 categories, and each one reflects how the brain and nervous system are reacting to alcohol withdrawal. Number 1, nausea and vomiting. Number 2, tremors, especially with arms extended. 3, sweating even without activity. 4, anxiety from mild unease to panic. 5, agitation, restlessness, inability to sit still. Then we move into sensory disturbances. Tactile disturbances, things like itching or the feeling of bugs crawling on the skin. Auditory disturbances, hearing sounds that aren't there. Visual disturbances, seeing things that don't exist. Number 9, headache or a feeling of pressure in the head. And finally, orientation. Does the patient know who they are, where they are, and what day it is? If you notice, CIWA focuses heavily on the brain, not just physical symptoms. Which symptom do you think scores the highest, most often? Tremors or anxiety? Guess below. Each category is scored individually, and then everything is added together. Here's how the total score matters. A CIWA score of 0 to 9 usually means mild withdrawal. 10 to 18 is moderate withdrawal, and 19 or higher, that's severe withdrawal and are also predictive of the development of seizures and delirium. This is where the risk of seizures and delirium tremens increases significantly. The higher the score, the more aggressive the monitoring and treatment need to be. Is there any treatment needed? Yes, it depends on the scoring. Core interpretation. If CIWA-AR score is less than 8, pharmacological treatment is not necessary. If CIWA-R score 8 to 15, pharmacological treatment may be appropriate to prevent the progression to more severe forms of AWS. Pharmacological treatment is strongly indicated in patients with CIWA-R score greater than 15. Why CIWA matters. CIWA isn't just a checklist, it directly guides medication decisions, most often benzodiazepines. It helps clinicians give medication when it's needed, not too early and not too late. In real hospital settings, CIWA assessments are repeated every 1 to 4 hours depending on severity. That's because alcohol withdrawal can change fast. If this explanation made CIWA finally click for you, take 1 second and hit that like button. It really helps this video reach more healthcare learners. Comment below if you want to practice CIWA scenario, exam questions or real-life case breakdowns. And don't forget to subscribe because clear knowledge saves lives. I'll see you in the next one.